Hey, FloodGate family, welcome again to another edition of our Leadership Live. And I'm excited to announce we've got Chris Horton with XACT Robotics, who leads all their sales and marketing, and here to share some of his insights in leadership. Chris, thanks so much for taking the time and joining Leadership Live today.
Good afternoon, Joe. It's a pleasure to be here and a pleasure to speak to the group. Yeah,
absolutely. And Chris, I know you, but I know a lot of people that might not know you on this particular call. So give us a minute. Tell us a little bit about yourself, and I'd love to understand where you are at XACT Robotics as well.
No, I appreciate the opportunity. So it's been a wonderful journey. I feel fortunate after now close to 30 years in the medical device industry, having had the ability to work with not only some amazing technologies and see the evolution of healthcare, but great people along their journey. Great people that start off as colleagues and truly become your friends and best friends over the course of the years. Yeah. When I date back and I look to, my first endeavor into medical device working for US Surgical, those were unique times, and it's been interesting to watch how the industry's evolved. And, shifting from several startups along the way, from companies like Cybronics, one of the first neuro pacemakers, to the earlier years with Kyphon, to some of the global companies like the US Surgicals, the Applied Medicals, the Merit Medicals, and others. It's been an experience as well as a great learning experience for me to have the privilege to work in those startup early stage as well as the global companies along the way.
Yeah, that is really a combination. You've seen every piece of it, and I think you mentioned, it is a small world, right? That network that crosses and makes this industry so much fun and interesting, right?
Correct. Yes.
Yeah. Well, knowing what you know and looking back over those 30 years, I'm curious, what do you think of some of the key attributes that make a good leader in this space, in this med device space?
Sometimes, we approach this as a business, and it is a business. Healthcare is a business, and more prolifically, it's become more and more a business over the years. Hospitals have to act and function more in a business mentality. Physicians have to act more as business persons, not just clinicians. And so industry has to continue to find a way to incorporate as a true partner in those activities. But I think what makes a true leader is understanding that marriage and that partnership between industry and healthcare, and ensuring that the patient never gets lost in the process. And if you always keep in mind the patient outcome, then that enables you to help manage the process within your organization, the delivery of good technology, and ultimately, once again, incorporating into the process of care.
Yeah, so it's really understanding that business viability, but with that patient-first outcome mentality, right? Understanding without either, it's not going to work, right? You got to keep that balance to be able to kind of perpetuate the business. What I hear you saying. Yeah.
Correct.
Good point. Hey, everybody listening today, I know I'm going to ask some questions, but at the end of this, you're going to have an opportunity to ask Chris some questions as well. If at any point, just post in a question into the chat below. We're going to take those at the end of this discussion, so you can pick his brain on different ideas, thoughts he has in the industry. So please, just anytime it pops in your head, just chat below. Another question for you. You 30 years, as you mentioned, there's probably some lessons, as I like to call them, you've learned along the way, the landmines you might have stepped on. What are some of those, or what are one of those you might want to share so others don't do the same?
I think the biggest mistake that you can make in life, whether it's in our professional world or our personal world, is making assumptions. And I think whether it's as a salesperson, marketing, whatever aspect within a medical device company you function within, or whatever aspect of leadership you function within, leadership internally and externally can be highly dangerous. So lessons along the way are truly understanding what your direction looks like, being flexible enough to continually evaluate and be able to continually change along the way. Yeah. You walk into working with a hospital under certain preconceived notions or assumptions. You try to do as much due diligence as you can to understand how you can, once again, best support the account, not just sell a product or technology or procedure, but best support the account. and you accommodate your portfolio to try to support that. You derive your business plan to support that. You set expectations to support that. But some of that is based upon levels of assumptions, but you should constantly reevaluate to make sure you're not living off assumptions.
Yeah, because things, to your point, change all the time, right? The dynamics with an individual you're leading, or the hospital you're doing, you've got to continue to pressure test that and adjust when you see the differences. But
right, and you're not necessarily although industry does have an influence on the direction of care, we are not the totality of care. And so that, once again, that partnership with our clinicians in the delivery of care, we should always be getting that voice of customer to make the right decisions as an organization to support the industry.
Yeah, that's awesome. Now, I have a question for you as far as, when you're leading teams, right? And I know whether it's in startups or some of the large, multi-internationals, whether it's Merit or U.S. Surgical, you've led large teams. But in those teams, there's those unique high performers, right? And I think every leader on this, listening to this today, had that. How do you develop those individuals?
So, as a leader, there's always a question that comes up and comes into play with how do you support and mentor and develop and help lead not only the high performers, but those that may be struggling as well. And to me, it's an intertwined activity, because as you work with your high performers have proven that they can be successful. Right. Not necessarily exclusively, because different markets operate differently, and somebody who may be successful in New York may not have the same level of success if they were placed into a different market, and vice versa. Right. So there's got to be an understanding that success, although often the credit to the individual, is also sometimes a credit to the situation. And so when you're developing a high performer, there does have to be a sense of reality, a sense of humility, as well as a sense of leadership and ownership. I think the best way to get the most collectively out of a team is to also have the team inspiring one another. It shouldn't be a dictatorship. It shouldn't be authoritative. I think the most productive environments are those where it's a true collaboration as a group. Right. And so to inspire those individuals to really take those steps forward, have those learned experience, reaching out. It's so often, I get excited when I hear individuals that I work with as part of a group are talking amongst each other.
I love that.
Because now you've got shared experiences, you're learning from each other. Everybody should be willing and capable of understanding they can learn. I try to learn every day. I learn from the team that I collaborate with right now, my XACT family, on a regular basis. I don't have all the answers. I try to shed my wisdom, but I'm also, once again, humble enough to know that I can learn from those around me.
Yeah, that's true. I love that. I think, Reagan said, I'm the smartest man in the room. I've already figured out the first problem, so you've got to have that collaboration, that group thinking. And there's nothing better as a leader when you get people, when you learn about a great thing that happened after it already was done, and you had no clue, you had no start of it. It just happened. That's one of the best things as a leader. I think you'd agree,
Agree.
Having that happen. Absolutely. So, developing those high performers is part of it, but you got to be able to find it, and this is something near and dear to my heart, being FloodGate. So how do you find and then evaluate the new talent to bring on board? What have you done in the past? What's important?
I think I shared with you as we were talking the other day, I was traveling with one of my colleagues on the West Coast just recently. And we were talking about this conference, this podcast coming up. And he asked me, what do I look for in an individual to join the team, or when I'm looking to bring somebody onto a group? And to me, it's always been about the excitement of the individual. It's been about their motivation. It's been about their energy. You can't teach drive. You can't teach energy. So when I'm looking for somebody to potentially join the teams that I've been a part of, it's the enthusiasm of that individual, the energy of that individual. There's a lot of things you can teach, and there's things you can't teach. So when evaluating that person, to me, first and foremost, it's got to be about that person's excitement, energy, and drive. And I look back at my own self as self-evaluating in comparison there's been many points in my career that I've had to learn along the way. That my time at US Surgical, every company puts you through and should put you through a rigorous training program. That's understandable and expected. And so there should be obviously the bandwidth to be able to learn quickly, but as well as, once again, you can't teach the energy.
Right. Yeah. No, you that innate drive, that willingness to take that leap. Right. Yeah. You can't teach that. You can help them once they take the step, but get them to take the step, especially in our world, which is mainly remote. It's got to happen from initiative. Now, you talk about those high performers, right? Hiring the right talent. We get a lot of those people on this call, and they're looking at their career trajectory, and they want to know what aspiring leaders should, how do they get noticed? How do they get tapped? What sets them up? What actions should they be taking that if they want that leadership, they're being recognized? What have you seen in the past? What would you recommend?
So, you look around, and you can look to sports. There's a lot of analogies that are brought up in sales or in business. And you look, to the sports industry and how many great athletes, those truly high performers, became great coaches. Not necessarily all the time.
No.
Some of
the greatest coaches were never great athletes.
Vice versa, correct. And so it's not always transferable. So to me, becoming somebody, in my opinion, when I look to the people that help lead me, the individuals that I look to be the inspiring leaders to me, were the ones that understood the environment, understood the market, but they understood the individuals. And so I've had several great leaders that helped mentor me in my career. There were individuals that were personable. They were engaged with their team. They understood and took time to understand the others within their group and their team. You can't help motivate somebody, support somebody, partner with somebody unless you know the person.
Right.
It shouldn't be exclusively about the business. So we all understand, and there should be a component and realize priorities of our family and our life. So that understanding is important as a benchmark and a foundation for inspiring those on our team and those as we go forward. But then a skill set that I've seen in those that have mentored me and inspired to move forward have been those people that kind of give enough of that rope to kind of,
the proverbial hang yourself, but they don't let you do it, right? Yes.
But they don't let you do it. So they'll watch you, they'll lead you, they'll give you the information. But then it's, you need those bumps and scratches and bruises along the way without getting severely hurt. So they'll give you enough to hang yourself, but not too far where you're going to be detrimental, so that you can kind of learn along the way. And to me, it's then giving the opportunity. So it goes back to one of those prior questions. I've always appreciated the chance personally, but as well as to help position people within my group and my teams to take a spotlight opportunity. I think that people appreciate that as well. It starts to give them the opportunity to get engaged. It develops the skill sets to communicate more effectively with other individuals, to help lead other individuals. You don't just jump into leadership and be successful. And just as you practice everything else in life, those opportunities to practice along the way, I think, are crucial as well.
Right. Yeah. No, I think it's, those spotlight opportunities are important, right? Where you can, break out of the masses, so to speak, and show what you have. And, one of the recommendations I have is sometimes don't wait for those to be given to you.
So, and that was going to add to that too. So it's not just about waiting to be tapped on the shoulder. It's reaching out and offering, once again, the best environments, whether it's a startup. I see this day in and day out with my XACT family, people willing to go beyond and above their current kind of quote unquote responsibilities to ensure the success of the collective group and team in the company.
Yeah.
And when you do that, those opportunities become available to you, but they also position you for those leadership roles as we progress.
Yeah, absolutely. You see a need, fill it.
Correct.
One of my leaders that I hired was a guy that we didn't have a true training manual, so to speak, for sales. It was just, and created it we didn't ask him, saw a need, was doing training. He's like, we've got no format, he just built it. And guess what? He became one of our leaders. He did it as so that's that kind of activity. Guys, please, I see some people putting some comments in there. Put a comment below, and we'll be able to pull those in. Ask Chris some of these great questions of, leadership or the industry, anything like that. I'm sure he's open to answer those. So please just post that below, and we'll check those out in a moment. A little fun question here for you, right? To keep you on your toes. Your favorite superhero, but why?
So, there's obviously with the way that DC and all the movies have come out recently over the years, a lot more of the kind of the traditional superheroes have gotten attention. Your Supermans, your Batmans, even your Aquamans and others. Interestingly and comically, when I was a kid, I loved the Flash.
Right.
So I ran track when I was younger. To me, the ability to be in one place to the next in a matter of a split second, the blink of an eye, I thought that was a really exciting opportunity, a really exciting characteristic in a superhero. Yep. To be able to be in one place and blink an eye and all of a sudden you're gone and you're somewhere else.
And I'm guessing that might have something to do with the fact you have to go to 4 different cities this week. And so instead of sitting in the terminal at JFK, you could just run there in a flash. That sounds a lot better.
To teleport, to blink an eye, and to be in New York to Virginia to Miami to California, that would be a wonderful skill set.
Yeah, yes, it would. Yes, it would, especially the worlds that you live in. Needing to be all those places overall. So good. Well, let me turn over to questions to the FloodGate family again, guys. Please just put a post in there if you got questions. But a couple questions we do have. Looks like this one's from Jacqueline. Hey, your favorite leader that you've had and why? What would you say?
That's a challenging to say that there's one is truly unfair. And I apologize if this may be one of the longer answers to the questions. So, currently within XACT, I do have to give a shout out to the leadership here. Whenever you step into a truly, that startup environment and you're really being disruptive with a technology, to have that flexibility to make a difference in your fingerprint on the world, once again, for the betterment of patient care, takes unique and really kind of dynamic leadership. So, a shout out to our chairman, our CEO, and the rest of the leadership team here at XACT for the capabilities to function as a family and still be, so dynamic and empowering to be able to push through and really kind of make our footprint in this industry. I look back to, my infancy of my career. I had a leader at U.S. Surgical that was epitomized that description I shared earlier. I respected him as a person. He gave me enough rope and a noose to hang myself, but I always knew he was there to catch me as I started to fall if I did fall. And always had my back, and I think really made a big difference in the way I led. That same person actually transitioned with me over to Cyberonics when we left U.S. Surgical, and we had a situation where there was questions about a person's performance within the team and the direction of this individual as we progressed as an early stage company. Mm-hmm. And I remember this person standing up to our leadership at the time, senior leadership, having the confidence that they could mentor this person, more importantly, having the confidence in the person themselves. Mm-hmm. And a year later, the person was one of the top performers within the company. And a year after that, became a manager within the company. And so to me, to see that level of leadership, and I've seen that across other companies as well. But to me, sometimes that is a rarity for somebody that knows the right thing to do, is willing to go to bat, despite some conflict of interest or conflict of opinions, I should say, and do the right thing for the people. To me, that's a leader.
Yeah. Doing the hard thing when it's unpopular, doing the right thing when it's unpopular.
it's easy when everything's good. When things are struggling and you go out on a limb, especially for your team and your people, not only is it the right thing to do if it's truly the right thing, but to me that ultimately develops the company into a better place.
Can't agree more. So have another question here. Kind of talked a little bit about what's going on, XACT, but innovation trends you're seeing that are coming into the med device space, or in the robotics, and just whatever segment you think is kind of that most intriguing for you right now.
So I haven't done it to this point. I'll give a little bit deeper plug for XACT. I'm here for a reason. When we look back over that 30 years to lead into that, I've always tried to align myself and feel fortunate that I've been able to with innovative technology. Going back to US Surgical, then to Cybronics, to Kyphon, Endocare, Applied Medical, some other companies along the way, from Ontaris to Merit to here. Not looking so much at commoditized avenues, but really transformational and disruptive technologies.
Yeah.
What attracted me when I was approached about XACT was not just another robotics, because there is a kind of this, you've seen the evolution and the progression of robotics everywhere now. And there is a value and benefit to many of the different robotics technologies, but there's also limitations to many different technologies. What XACT, to me, I think is a great evolution within the space that we function within interventional procedures, because it doesn't just do one procedure. It doesn't have just one indication for use. It doesn't force proprietization of even instruments off the shelf. The ability to accommodate to, the physician preference for instrumentation, the ability to accommodate to different indications for use depending on the application, whether it's a lung case or an abdominal case, kidney, et cetera, to support different types of procedures, from biopsies to ablations to other challenging indications. To have that diversity in a platform, I think, is the next evolution of technology, and proud to be with XACT for these evolving and more broader capabilities and capacities or utilities within these technologies. It's one thing to be an innovative technology that's a one-trick pony. It's another thing to have a true return on investment to an institution.
Yeah, true platform. I mean, at a certain point, they got to have a room full of robots, right, to bring in different ones for different procedures. There's going to be
or to be mobile enough, and that's the unique thing about XACT as well. We kind of describe it as being the size of an iPad, and so that instead of that robot that consumes the entire room or has a room built around it, the ability to be able to move from room to room to accommodate and be that flexible within the clinical space, I think is an evolution in where we are going in medicine.
That's pretty cool. Well, last question here is from Yannick Lang. This is a question we hear all the time, actually. Do I move into leadership or stay in a rep, right? What's that, right? How's that right? How did you make that choice?
No, it's a valid question. Once again, those different sports analogies, there's a lot of players, and we, now into US football season, we're seeing, some records being set for players later in their career at some older ages still playing out there in the field.
Right.
And so, there's a direction to kind of maintain that singular direction. To me personally, I've got a son that, I cherished every moment helping raise him over the years. And to be out coaching pretty much every sport under the sun, the ability to help kind of mentor and lead others. There's I think a great appreciation when you can help make a difference in somebody else's life. Not just, once again, within our industry, the patient that I feel we need to repeat first and foremost. But if I can help make a difference in the teammates around me, if I can help make a difference in the organization around me, if I can help ultimately translate into making a difference in the patients and the communities we serve, that broadens when you have a chance to do it on a leadership level versus on a singular, independent or, individual contributor level.
Right. Yeah, absolutely. No, you can be really that more of that force multiplier effect, right? and have direct impact long-term on different people's lives. But
Right.
there's different people, like your point. Certain people like to play the game and some people like to coach, and it's
priorities in life come into play as well. So
Yeah.
there was a point in my life where I needed to make personal changes that putting my family first and foremost.
Yeah.
And to me, that should always be paramount. And then as life changed, it gave me the ability to get back into avenues of leadership and expand on those levels. So there should be the importance and the priorities in life. To me, family is first. And then, and supporting the company and my company and my XACT family in this situation.
Yeah, great point. Great point. Well, Chris, thank you so much for, imparting your 30 years of learned wisdom and the lessons of, I'm sure your many mentors, especially the one at US Surgical, sound like an incredible leader to our greater FloodGate family. So thank you for taking the time. And if you're watching or you're catching this later, and if you do have additional questions, just ping us below, put a note, there, or directly. Happy to help answer any questions you have. Chris, thanks again for joining us. We enjoyed this time.
I appreciate it, Joe. It was a sincere pleasure.